placed immediate implant after extraction in the lower right premolar, you haven't placed the bone graft. But today, in the same type of case of lower right premolar, you have placed bone graft after immediate placement after extraction. So my question is, when to place bone graft and when not to place the bone graft in case of immediate implant placement after extraction?
Okay. So question is, if we are extracting the tooth, at the same time if we are placing the implant, then that side needs to be grafted or not, right?
Yeah.
See, there are multi-rooted tooth and a single rooted tooth in the mouth. If you are extracting the multi-rooted tooth and you are planning for the immediate implant, then definitely you have to graft the side. There is no confusion about it. But if you have a choice, when you are working with the single rooted tooth and you are extracting the tooth at the same time you are placing the implant, then in some cases we have to graft, that is mandatory, and in some cases we can avoid. So in which cases we can avoid? So there is always a discrepancy between the implant shape and socket shape. So once you follow the lingual plate placement, always, that is mandatory as you know, then there is a high chances of the gap of the implant surface as well as buccal surface of the implant as well as buccal wall. So that distance, it is known as a jumping distance. So if it is less than 2 mm, then still you can take a chance without grafting, you can close the site. But if it is more than 2 mm, then definitely that distance may not covered by the osteoblast. So you have to graft at the site. In today's case, one more thing I would like to add. There was a less distance than 2 mm. Still I grafted the site because again the buccal wall thickness, that what is remaining, it is also important. So if you have a sound buccal bone, means more than 1 mm thick buccal bone, then you can take a chance that in 2 mm distance even you can avoid the graft. But when there is a thin buccal plate, then it is always better, though there is a 1 mm gap, always better to graft the site. Clear?